Time to welcome back our panelists for one final discussion. Doctors and medical practitioners across the board have been leaving New Mexico, and local lawmakers aren't sure what to make of it. According to the New Mexico Healthcare Workforce Annual Report, New Mexico is below the national benchmark for its number of primary care physicians, psychiatrists, OBGYN practitioners, and general surgeons. The journal reports most local doctors point to is 2021's medical malpractice law, which raised the cap on damages and increased the cost of medical malpractice insurance. Senator Feldman, that increased rate is somewhere between 2 or 3 times the rates found in Colorado, Arizona, Texas. Should we be surprised here at this result?
The increasing cost of medical malpractice insurance is one piece of the puzzle. But our shortages in the health workforce predated the passage of the medical malpractice bill, or the lifting of the cap, the medical malpractice. This is an old story. We have always been really short of primary care physicians, especially in the rural areas, and specialists too. And so we have tried various solutions. The malpractice is one part of it. Medicaid is another part of it. And loan forgiveness is another part of it. You know, there are a lot of things that sort of militate against New Mexico when we're attracting doctors here. We've tried to grow our own workforce from UNM with the BA-MD program. That has worked, but it's slow going. It's not like, you know, somebody that graduates from Yale Medical School is going to want to locate in Roy, New Mexico, and their wives are going to wonder, is there a Nordstrom's here? And no, there isn't a Nordstrom's in Roy.
That's right. Interesting point there.
Some rack.
Well, there
Maybe
you go.
a rack.
Good enough. Sirs, the numbers are not good here. According to that Healthcare Workforce Committee report, we are 334 primary care physicians below where they say the provider to population benchmark should be. That's a big number. I mean, it's a whole lot of people. I'm a little lost at how we turn that kind of thing around, but again, your sense of where we are with this kind of loss, can we blame it directly on this 2021 bill, or as Dee Dee mentioned, something else going on here as well?
I think it's you know, just too facile to say, oh, we passed this and therefore there's a straight line. Right? I mean, we're a very rural state. It's not just New Mexico. Rural communities around the country have had trouble attracting and retaining doctors. Right? And that 330 shortage is not evenly spread throughout the state either, right? It falls more disproportionately on areas that are more rural and have lower populations.
Let me ask you this though. There's in the journal article, really interesting quote here. Dr. Todd Williams of San Juan Plastic Surgery in Farmington tells the Journal he's paying guys about $65,000 a year in malpractice insurance. He said the same insurance would cost $18,000 a year if he did it in Colorado, just a few miles away. That's a big difference. That's not like a 10% or something.
I mean, and that's the kind of thing that, you know, the economics are what they are. That might be the kind of thing that a creative state approach to it would say, look, we can maybe address some of that through helping with those insurance premiums or be a self-insured state.
That's
I don't, you know,
That answer's yet to be right.
I have no idea the actual numbers, right? But I'm saying
Right.
it cries out for a creative solution that is not throw up our hands and say, yeah, I guess everyone's going to drive to Colorado.
That's right.
Right? It's to say, okay, if it's purely a money issue, and I know so many things I say, oh, it's just money, right? But like that can be dealt with, right? You can say, oh, if that's all it is, then we can help that and make sure folks stay in Farmington and Roy and whatever, right?
Let me ask Dee Dee on a similar question, and Diane, I want you to get on this too. Some Democratic lawmakers have balked at the idea of rolling this thing back, as you might know, the 2021 legislation, saying the law was a bipartisan compromise, should be given time to work. Is it too early to amend this, say, if we wanted to do this in the session now? Are we jumping the gun here, or should this have some time to sort of play itself out?
I think it will have time to play itself out because it's not going to pass this time. And it's only really been 6 months since the fix, the so-called fix, bipartisan fix, was in. Meanwhile, I'm with Serge. I mean, we have to look for some creative fixes to our healthcare system that does not completely depend upon the doctor.
That's right.
The doctor
That's right.
will fix it.
Yeah.
We have to, focus on community health workers and mid-level practitioners and telemedicine projects that will fill the gap in this kind of broken medical system that we have right now.
I know when you were in serving our state in the legislature, I remember you talking about Medicaid reimbursement quite a bit. That's still a big deal here.
Definitely.
Yeah, it's just, and I got Senator Snyder in on this. Again, do we fill in the gaps here with other things, or is this the solution, or?
Our other two panelists, Surgeon and Didi, have given very good list, but the one I didn't hear mentioned was the GRT on medical services.
Yes.
That is something they could fix. And also, this agreed to law in 2021, it was a lot of people said this is the best we're going to get right now. We've got to have something. Everybody was not in agreement about it. One of the big changes that's been coming, and I believe was included in this, is hospitals, physicians. There's a difference between private physicians and hospital physicians, and everybody was not included in the Patient Compensation Fund and the Medical Malpractice Act. But when you expand that, that's more people drawing from the pot of the compensation fund, and it was just a token amount of extra money put in. That is another issue they could very easily do this session. And with all the money, when you talk in terms of billions, extra monies, you need to fit in a major problem that impacts everybody. You ought to fix it.
Can I read you a quote? You guys all know Democratic Senator Martin Hickey. When he came to Albuquerque, of course, he was a physician, former CEO of Loveless, so I think he kind of knows what he's talking about on this. But he has a great quote here in the Journal. It said the state's patient compensation fund faces, quote, an actuarial death spiral, end quote, if something isn't done. With state government income of nearly $12 billion this year, Serge, as Senator Snyder just made the point, if this is a money fix, why don't we just get after it? We have money.
Like, it's hard to think of anything more important than the health of the people of New Mexico, and ongoing treatment, prevention, and setting up a infrastructure that's going to allow us to have a healthy state. And if our state can't be bothered to focus on this issue, I don't know what we can be.
Let me ask you guys a final question here, kind of a fundamental question we started with. If lawmakers were to roll back, guys, the cap to $600,000, the way it was before the law was changed in 2021, would that automatically solve the problem in your mind's eye, Senator? Is that the problem here?
No,
Okay.
that would definitely not solve the problem. And remember, it's a balancing act.
Right.
You do have to protect patients.
Yes.
You do have to
That's what
protect consumers.
Patients who have been wronged,
Yes,
specifically.
yes.
That's why malpractice is
That's
there.
right. And so that's why it's always a compromise, the level of the liability.
That's right.
And so, no, it would
But
not.
if there's enough money in the pot, you don't have this underlying debate about should the cap be lower, should the cap be higher, or at least it reduces the pressure. Have more money in the compensation fund. It's a no-brainer.
Yeah, it's a lot of money, but 12 million, it's not a lot of money when you really think about it. Last question, Serge, for you. Again, should just be visited at least in conversation in committee. Doesn't mean that something has to happen. Do you know what I mean? We have to have a conversation. Something's going on here.
Yeah, I mean, I think it's an issue that definitely warrants discussion and saying, okay, look, we may not fix it right now, but we're all committed to addressing this issue because it's so important for New Mexico.
On a personal note, this is one of those issues why we need a full-time legislature. You cannot discuss these things in the format we have now. You just can't. Thanks again to our line panel as always this week. Be sure to let us know what you think about any of the topics these are wonderful people covered on our Facebook, Twitter, or Instagram pages, and catch any episode you might have missed on the PBS app, on your Roku or Smart TV.